Thanks so much for being here with us. We're going to keep this pretty informal in general, so by all means jump in with questions as you have them. For those of you I haven't met, I'm Aubrey. I am the Partnerships Manager at DocStation, and I am joined by Max Andraig, who is our Admin Fellow. And so between the two of us, we manage all of our support requests from our pharmacies. We make sure that you have the information that you need, and we are especially excited to introduce to you the OneRx team out of North Dakota and this new program available through Clearstone, or Blue Cross Blue Shield Northern Plains Alliance. So I'll kick it over to the OneRx team to introduce themselves. Elizabeth?
Hi everyone, I'm Elizabeth Skoy. I am Associate Professor here in the NDSU School of Pharmacy, and I'm part of the OneRx team, and I'll be talking to you a little bit later here about how to implement OneRx in your pharmacy.
And my name is Jamie Stagg. I'm a pharmacist and quality improvement program manager with Quality Health Associates of North Dakota and the Great Plains Quality Innovation Network.
All right, wonderful. So glad to have you guys with us. Well, we're going to get into our presentation here and talking about the Safe Opioid Use Screening Task. So for those of you who are not familiar, we're just going to give the whole top to bottom on this particular task that's now available. It is based on the OneRx project and the tools that are available for through that project as well. So we're very excited to make this available to our Clearstone pharmacies. For the program itself, it is kind of a separate program. It adds this additional task in addition to the tasks that you're currently familiar with. And the program details are as follows here. So pharmacies who participate are going to earn $20 per completed screening task. And I'll make that distinction there. It is the completed screening task as opposed to the archived task. So DocStation will still allow you the opportunity to choose whether or not a particular task is relevant for your patients. So if it's not relevant, by all means, you can click right through it. But for those that you are able to intervene on, you'll earn that $20 fee for, or reimbursement for. To participate in the program, pharmacies must complete the OneRx training. And so we're going to talk a little bit about that as well. But the OneRx project team has provided some really incredible training resources to help pharmacists who are brand new to managing opiate therapy and helping patients, and even those who aren't brand new to it, just have a little bit additional support and understanding about the situation overall. So really excited to make that available. Once you complete the training, then you can notify or send your completion notice to support@docstation.co. It's all detailed very specifically in a help article there that you can access. And then we'll get you enrolled in the program. And then thereafter, you will start to see this task generate for new opioid prescriptions. So first, we're going to start off with a quick OneRx project introduction. So I'll kick it over to Jamie.
Thanks. We'll start out by what is OneRx? What does OneRx stand for? So OneRx stands for Opioid and Naloxone Education. It's a patient-focused intervention promoting safe opioid use. OneRx was developed by a team of faculty at North Dakota State University to support pharmacists in overcoming barriers often cited when dealing with opioids, including lack of confidence, training, and time. It's a pilot program that started in 2017 and was expanded statewide in North Dakota 2 years ago now. Supported by a grant from the North Dakota Department of Human Services. There are 4 key core principles to the OneRx program. The first is providing some education and training, really just to help kind of fine-tune those skills and addressing communication techniques and that as well with our patients receiving opioids. Then there is a program that is designed, a nice, simple and straightforward workflow with implementation. Coaching and support is provided through calls such as this and through our website, onerxproject.org. And then there are also data and outcomes, which DocStation will be supporting on this effort with Clearstone. If we can go on to the next slide. So that training that Aubrey referred to is available at onerxproject.org/Clearstone. It's a 3-hour free CE program. There is an option for pharmacists and for pharmacy technicians. And there are 5 modules that are included, including the science of opioid misuse and addiction, how to screen for risk of misuse and overdose, naloxone, opioid consultation pearls, and techniques for communicating with patients and providers. So it's a jam-packed course, but it provides a really good overview and some good continuing education. Then we look at the process, the program and implementation aspect of it, and it's a simple process that when you get your case queued up by DocStation, you perform a screening, which involves a screening for risk of opioid misuse using the opioid risk tool, or ORT, and then a screening for accidental overdose, looking at things such as comorbid conditions and other medications. Based off of your assessment of risk, a triage tool is provided as part of OneRx that helps guide you to the interventions that you may want to take with your patients. And these can range from things like discussing take-back programs to recommending and providing naloxone to referrals to community service programs. And it's all based on the risk and your assessment of the case. Next slide. We talked about some of that assessment and triage tool already, so this is just kind of putting that out for easier viewing with this. Also, you can use the PDMP in your own claims system to look at for some of those risks for accidental overdose. When we move on to look at some of our results that we've seen in this program in North Dakota, we've had over, this data is data through June, which includes over 6,000 screenings. I believe we're quickly approaching 7,000 if we haven't already passed it here. But there's a couple of things I want to highlight in our results thus far, is that about 4% of those screened do have an opioid risk tool score greater than 8, which indicates high risk for misuse. Also, about 20% are being identified as having risk for overdose. And we do see, in our program, we see a lot of patients that have received opioids previously. With this Clearstone program, it's more focused on those new opioid starts. So that data might look a little different once we get going with this program. We also do see a lot of comorbidities involved, especially depression and anxiety. When we look at the interventions that are offered and some of the results with that on the next slide, we do see we've seen some very positive results in this program. We're almost 90% of the time we have the medication take-back program being discussed and safe opioid disposal. We also have seen, for those identified at risk, we're seeing naloxone dispensing rates of about 10%, and that's 5 to 6-fold more than national averages that we've seen. So what the OneRx program has done is it's helped pharmacists communicate that need for naloxone and really target those individuals at greatest risk and get naloxone into the hands of those that need it. The other thing that's of interest to you all probably is that we found that on average it takes about 5 minutes to complete the intervention. Now, obviously someone with higher risk might take a little bit longer, and based on your screening, some with lower risk will take less, but it's really been an efficient intervention as well that our pharmacies have been able to implement. So quickly, in summary, just to kind of let you know how the the OneRx program has been successful thus far. It's effective and efficient in doing a screen for opioid misuse and overdose risk. Our pharmacists are using the triage tool and the education that they've received to take appropriate interaction. And again, we've seen a nice little uptick in the dispensing of naloxone to at-risk individuals. So we feel like this program has met its initial goals and really has this opportunity to grow, and we're grateful for this opportunity to partner with Clearstone and DocStation to spread this and bring it to your pharmacies as well. Thanks.
Excellent. Thanks, Jamie. We'll take a quick pause here. Any questions for Jamie on the OneRx program and its sort of initiation? All right, very good. No worries. We will continue moving forward here. So we're going to do a quick demonstration of what the task looks like in workflow on DocStation. Go ahead and pause my screen share here while I switch gears back over to the platform. Very good. Okay, so we are within the patient profile here, and we'll see this new task, the Safe Opioid Use Screening task. And very much like all of our other tasks, you have the option to start it or to archive it again if it's not applicable to your patient. So we'll go ahead and click start. And what you'll see pop up is the related medication. We know, of course, HCTZ triamterene is not an opiate. This is a fault of the demo environment as it is, but you'll see the related medication pop up on top. You can click into it and see the instructions either as you have entered them or changed them. You can indicate an adherence, a status if that has changed, and then add in instructions, related items, and notes as is needed. And these notes will tag specifically to the medication itself. So we can review that information. And then you'll see as we move down here are the two assessments that are available for this that contribute to that ORT, the opioid use disorder assessment, as well as the accidental opioid overdose assessment. So to begin these, we just click inside and we'll see this list of questions. As we find out this information about the patient, we can sort of check them off the list. So the first question here, does the patient have a family history of substance abuse? And then you select all that apply. So if there is alcohol, illegal drugs, prescription drugs, you'll see as you click the whatever the applicable items are, you'll see a score tabulate across the top. So, we'll say just alcohol for this instance. The second question, does the patient have a personal history of substance abuse? And then you select whatever it is. Also, of course, no and not applicable are available options as well. Then continuing down the list, does the patient have a history of pre-adolescent sexual abuse? Yes or no. ADD, OCD, bipolar, schizophrenia, yes or no. Depression, yes or no. So as we check the list, we've gone down all the questions, we'll see this score across the top. The score of 5 based on how we've answered these questions. According to the assessment results, this patient is at medium risk for opioid abuse. Safety counseling and naloxone is recommended. Now, again, if we had added in all of these others, the score gets much higher. It changes to say the patient is at high risk for opioid abuse and safety counseling and naloxone is highly recommended. So it's kind of giving you a little bit different perspective there in the intensity measures. So once you're done with that, we'll click done and you can open up the second one as well, accidental opioid overdose assessment. And this is just offering an opportunity to capture potential other factors that may contribute. So does the patient have a history with any of these other conditions? And you can select all that apply. So we know depression is potentially one, you may know anxiety is one, maybe kidney disease, however it may be. And again, in the same instance, you'll see the score start to tabulate across the top. And the second question for this assessment, while using this medication, is there a chance the patient may consume any of the following? And so we again, just check them off the list, cold or cough, alcohol, whatever it may be, and then you're left with this score. According to the assessment results, this patient is again at risk for accidental opioid overdose. Safety counseling and naloxone is recommended. So that's kind of how it'll help guide you through that process there. From the intervention section that you're already familiar with in DocStation workflow, we've just provided a list of suggested interventions. So these are things that we would suggest you also talk about in the consultation. It's not required to do all of them. It is required to do at least one of them to be able to close the task. So we'll review, we did do the opioid screening. It reminds you to check PDMP. You've already assessed for risk of abuse. You may perform a full medication review and additional pain control education. Again, just checking them off the list as you go down. And then in this other section here, you have the ability to write in a note specific to the task, as well as the related item, and continue. When we click continue, again, for those of our pharmacies who are CPESN members, an e-care plan will automatically be generated and submitted to CPESN on your behalf. And that information, again, is captured, submitted to Clearstone along with your other task information. And that's the long and short of it. Pretty simple in terms of task workflow. Fits in real nice with what you're familiar with. Any questions on task workflow at all? All right, good deal. Go ahead and come on back over here to our presentation. All right, and at this point, we're gonna just talk a little bit about what it's like to implement the OneRx program into your pharmacy. I wanna kick this back over to Elizabeth, who can kind of gives us some pearls of wisdom. And again, by all means, as questions come up, you can either type them in the chat or just unmute and let us know.
Thanks, Aubrey. So before we get into some of our best practices and tips, I just want to reiterate that the purpose of us starting OneRx was really to prevent that opioid misuse and accidental overdose at the pharmacy level, and also to ensure that in addition that our patients are utilizing those opioids safely by gathering information that typically isn't always available to the pharmacist. And so by asking our patients these important questions, we can gather very pertinent information to ensure that they're utilizing their opioids in the right manner, and also that identifying any risks that they may have. And so our best practices, if you're talking with a patient, first of all, just providing that screening. Again, that screening will more than likely be via telephone when you're asking those questions, and opening up by just saying that you're doing this for every patient that's prescribed their first opioid. And so letting them know that they're no different than anybody else. And so a conversation starter may just be introducing yourself and just saying that their coverage has, or their third-party coverage or Clearstone has asked that this screening be provided to every patient that was prescribed an opioid for the first time, and then going through the questions with them and just letting them know that you're doing this to ensure their safety. So that's kind of are one of our best tips we've gotten from pharmacies as to the best way to initiate that conversation. And then of course, if there is that risk for accidental misuse, or if they're at a higher risk for opioid use disorder by the top part of that form, by asking some of those questions, just talking them through that, letting them know of that risk. And also if they need any sort of support or services, being able to provide that to them. And then also, of course, that bottom portion of just recommending that naloxone if they are at risk for any sort of accidental overdose. And letting them know that obviously, where they can obtain the naloxone, hopefully from you at the pharmacy. But then also we just really, and you'll hear this in our training when we talk about the naloxone, is that we really look at naloxone as a safety measure. And so letting those patients know that we recommend that they have naloxone in their home, but it is for safety. So it's just like a seatbelt. We hope that, when they put their seatbelts on when they're driving, we hope that they never have to utilize that seatbelt to save their life. The same thing as with naloxone, is that you're recommending that they might have it in their home because of their risk for accidental overdose, but of course you're hoping that they never do have to use that. And so those are some of our, tips that we've gotten from pharmacies as to being successful. Also, our patients have been very successful, or very open to this form of intervention. And as Jamie mentioned, we're approaching 7,000 screenings. So 7,000 times that a patient's provided that information without question and has provided that information to the pharmacy, so the pharmacist can make their best judgments for the patient and to ensure their safety. So with that, I want to make sure that we have some time, obviously, for Q&A. So we'll kind of open it up to Q&A at this point.
Hi, this is Austin. Do we know what the copay is for naloxone for the Clearstone patients?
That is a great question, Austin. I haven't been asked that yet, and I do not know. Let me find that out and get back to you.
Because I know that in the past, that has been even like we had a different program that was similar to this. That was a big prohibitive factor. Like you'd get them on board and then you'd run it through and it would be $100 copay. Well, it's very hard to convince somebody who has like to spend $100 on anything, let alone an in case thing.
Yeah, absolutely. Okay, that's a great question. I will get back to you with that information. Thanks for asking that.
Thank you. And then I guess a second thing is, I think that is a good approach that you guys are talking about. But what do you do with the patients? I guess even though I kind of use that approach, I'm still getting people that like the instant you ask them, it's like they can't hear anything else beside they feel like they're doing something wrong by taking this medication. Like they clearly had a surgery, clearly need it, and no matter what you say, like they just get very defensive, and I have a hard time getting them back after that. Even if you say, everybody does, like everybody's getting asked the same questions. What did you guys do with those patients that still after that approach?
Yeah, that's a really great question. I'll answer in the first two parts. And I'm not sure of the Clearstone copay, and Aubrey, I know that you wrote that down. Hopefully that information can be provided to you guys. For some of our pharmacies, though, that have been in areas where patients may not be able to afford the naloxone, I would recommend checking with your local public health department, because sometimes they have grants or naloxone available free of charge. So some of our pharmacies have actually been partnering with those public health units, and the public health units have just been providing naloxone to those pharmacies, and they almost keep it in a separate area. And then when a patient can't afford it or pay for it, then the pharmacy can provide it, and they just have to do some documentation. Granted, that particular collaboration is unique to North Dakota with some of ours, but the funding that comes from that naloxone distribution is actually federal funding that every state has some form of, it's called an opioid response grant from the federal government. And so there should be some availability for partnerships there within your own state and in your own public health unit. So I would recommend reaching out to them if it's not affordable for your patients. And then the second one, that's a really great question about, how you have that conversation. And I think how I've approached it with patients, and I've had pretty good luck with this, is just saying that we, just letting them know, we know that you've taken this, and remember for your Clearstone patients, they'll have already been taking it for a few days by the time that task is typically coming to you. And so letting them know, first opening up the question, how's it been going? Is your pain being controlled? And, just letting them know, hey, I know you just had surgery. How was that? Do you find that this medication is working for you? So kind of asking that, making sure that their pain is being controlled, because like you said, they are taking this for a very particular reason, and you don't want to question that necessarily. If you obviously identified that they shouldn't have been taking the medication, that would have been done beforehand at the dispensing level. So asking them how it's been going for them and how their pain's being controlled, and then just letting them know, this medication is incredibly effective for pain relief, and we're hoping you're experiencing that. However, it does have some side effects with it, and we just want to make sure that you're not going to be experiencing any of those side effects, because some of those side effects can actually be life-threatening. So if you don't mind, I'm just going to ask you a few questions that we're asking everyone who's prescribed opioids, just to make sure that they aren't going to have any of those side effects. And then all of a sudden the conversation shifts from, wow, you're concerned about their health and safety, versus I'm concerned that you're doing something you're not supposed to be doing with the opioid. And that's definitely not what we're looking at, because again, we would have identified that hopefully at that dispensing level of when we're checking that prescription drug monitoring program and looking at their profile and things like that. So I hope that provides a little bit of insight into that. And I know every patient and every case is a little bit different.
Yes, I think that's good. Thank you.
I have a question that kind of piggybacks on a point that you just made, Elizabeth. Since naloxone laws will vary slightly by state, and the NPA plan spans across several different states, What's the best resource for people to learn what those intricacies are at the state level?
Sure. So the first place I'd always check is your state board of pharmacy to identify your own state laws as to what you can and cannot do when it comes to naloxone prescribing. If you are a state that does not have the independent prescribing authority, like for instance, North Dakota has that. And so our North Dakota pharmacists, they have to register with our board of pharmacy as a naloxone provider and follow our protocol, but they can independently prescribe then at that point, not in a collaborative practice agreement with a physician or another prescriber. But some states do require that collaborative practice agreement in place. But to be honest, some states make it very easy. And so I'm just going to give the example of Minnesota, for instance. A lot of times through the state health department, they've identified either state health officers or other providers within the state that are just open to those collaborative practice agreements, because specifically if you're looking at naloxone has a high safety profile, very low risk of adverse effects, as well as easy to use. So especially with some of our newer dosage forms, so providers are very readily willing to go into those collaborative practice agreements. So some state health departments have actually already identified prescribers in the state that are willing to sign and collaborate into those. For instance, I know in Minnesota in the past, some pharmacies have inquired about that, and there's actually through the state health department, there's like a questionnaire that you can fill out, and they automatically send that to the provider to get you into a collaborative practice agreement with them. So State Board of Pharmacy, first place I would check, and if they have a resource of someone, hopefully they'll provide that to you. And then if they don't, then I would check with your state health department.
Thank you so much.
Excellent. Any other questions before we wrap up?
I have another general question, more specific to the task in DocStation. If I'm a pharmacy and I opt in, at what cadence are those tasks generated? Is it going to be similar to anything else that I'm currently seeing in an NPA pharmacy? Aubrey, that's probably a good question for you.
Absolutely. Yeah, thanks for asking that, Max. So this task, as we mentioned before, will generate for all new opiate prescriptions. The look back, or the historical look back for claims data, is 6 months. So we're looking at a patient who is newly prescribed this medication, has not previously been prescribed this medication in the last 6 months. So it's possible if they had a different type of opiate prescription in the last 6 months, this is a brand new one, this task would still generate for that patient. If they are chronic users or get regular monthly refills or have at some point in the last 6 months, this task will not yet generate. So they kind of need to meet that threshold. So it's a great thing to see. So in that instance, it does generate very similarly to the other DocStation tasks, specifically the new medication task. So it'll look a lot like that. Thanks for asking that.
And you might have said it earlier. Sorry, you might have said it earlier in the presentation, but will that task trigger more than one time if I have a new opioid medication at a couple different times in the year?
Sure. Yep. It will trigger every time for a new prescription. So if your patient is trying various different types of opiates for various reasons, not sure what the use case of that may be, but if that's the instance, it will trigger multiple times. And then you'll be eligible for the intervention reimbursement for that each time. For the specific intervention, for each one individually, it would only generate once per patient per year. So again, if you're seeing new or different types of opiates, then you would see that task more than once. Generally, that wouldn't be the case as we would expect. So so you would see this task probably once per year per patient, or potentially once per 6 months, again, depending on that look back window.
Awesome, thank you.
Aubrey, we're wondering, will this just generate for Clearstone patients? Is Clearstone a type of insurance? We're wondering if we'd see them show up here in Minnesota. We've never heard of Clearstone.
Oh yeah, I'm sorry. So Julie, the program that you're currently involved in with DocStation is a Clearstone program. So Clearstone is sort of a third-party management company for Blue Cross Blue Shield Northern Plains Alliance. And so the Blue Cross Blue Shield Northern Plains Alliance is a conglomerate of blues from our 7-state area. So it's Montana and Wyoming over to Minnesota and Iowa. And so that's the program that you're currently participating in. We refer to it as Clearstone again because they're sort of the third-party management company. They're the ones who are helping DocStation with the pilot program that we're initiating. They help us confer with Medicare and the Center for Innovations projects with Medicare as well. And they're kind of helping us with this pilot program. So I apologize if that's a little bit of confusing nomenclature, but Clearstone equals Blue Cross, if that helps.
Awesome. That does help. Thank you. Thank you.
Yeah, of course. Thank you for asking that question.
Aubrey, I'm just going to piggyback off of our previous question too of just the clarification. So if you do have a patient that gets multiple opioids, let's say that they had one, and then 3 months later or 2 months later they get another one, from a OneRx perspective and what we've seen is by all means don't dismiss that task. Because that's still a very important time to talk with that patient because things could have changed in their life. They could have, obviously something could have changed between their last opioid and this one. Also, it's a really great time to talk with them to make sure that they previously properly disposed of their previous opioid. Sometimes if they have one for pain and then they prescribed another one a couple months later, maybe they're still having that knee problem, they might not realize that those two medications are both opioids. So if one isn't cutting it, they might say, well, I'm going to take that one I got a couple months earlier and add that on. And so really important to identify those patients and making sure that they have properly disposed of their first opioid and that they no longer have it. So those follow-up calls, I know it's as part of your task list as well, but that's a really great time to identify that the patient, if they're done or they're almost done with their medication, reminding them of proper disposal is really important. So just thought I'd put my plug in there too for that question.
Yeah, that's great. Thank you, Elizabeth. Excellent. What other questions are out there? Anything else? Okay, good. Well, I hope you guys have found this session to be valuable. We'll just kind of wrap up with the last tips for getting started. So,
hey, Aubrey,
yeah, go ahead.
I do actually have one more question.
Of course.
Also, I just wanted to say hi to Elizabeth or Liz for Dr. Skoy.
Hi, Katie.
So I'm currently the resident in Willmar, Minnesota, and I work on DocStation quite a bit. And my project or my residency project does involve getting naloxone actually out into the community. If we happen to, let's say when we dispense the opioid at the beginning downstairs and we get that opioid or the naloxone sent out and then it pops into DocStation, can we essentially, since we got the naloxone out there, is there a way that we don't have to recall the patient and kind of get all of that and can get that reimbursement, if that makes sense? So my question.
Sure. I see. So you're kind of doing things, you would be doing part of the task workflow ahead of actually receiving the task, essentially.
Yeah.
You're doing it to start.
Yeah.
So that's a really great question, Katie. And the true OneRx program does work that way, where you would be, managing that naloxone and the assessment tool essentially right at the point of prescribing. It's a little bit difficult in terms of workflow when you're working with a payer program specifically. So the one piece that I would want to make sure doesn't get missed, and that is really crucial, are those 2 assessments that are within that task. So if you happen to have a way to get those questions answered, ahead of time, then you could certainly just fill in when the task generates and you don't have to call them again. But truly the piece that you would want to be, those assessments really are the pieces you would want to be capturing in order to complete the task and earn that reimbursement as well. So of course, if you have already dispensed the naloxone, you can kind of frame that conversation like Elizabeth had said, calling as a follow-up, make sure the pain medication is working the way it's supposed to. You don't have to talk about naloxone again. You could just check off the box that you talked with them already, and that part would be okay. We just want to make sure that you're able to capture the information from the assessments as well. Does that make sense?
Yep, that does. Thanks for that clarification.
Yeah, perfect.
too, Katie, if you guys are doing that, which is fantastic, on our OneRx website, we do have all of our forms in paper form. And so the exact same questions that are being asked in DocStation, you can actually print off our patient intake form and give that to the patient at the time that they're receiving their opioid, and then just save that information. So then when that task comes through, then you can just pull up that patient's form that they've already filled out and then enter in that information, as well as any follow-up that needs to be. So by all means, I think that could still work into your workflow. And we have some North Dakota pharmacists that are actually going to be doing that, where they're still going to be potentially providing that paper form to them, but then keeping track of that and making sure that they do any follow-up that they need to with those patients, but that they have completed those 2 key pieces of information that screen for misuse and accidental overdose.
Awesome, thanks.
It's good, and I'm glad you brought that up too, because it's great to know Clearstone has partnered with OneRx and DocStation to make this a much more widely available. The program started in North Dakota, and now we have pharmacies across our 7-state region who are interested in actively working on this program, which is really exciting. But we are still working on other ways to continue to deepen that relationship and make more of this program available to pharmacies outside of North Dakota. So there are logistics and things, but this is this sort of first start in moving in that direction. And as you guys know, DocStation prides ourselves on keeping a really tight feedback loop with our pharmacy partners and knowing how things are going and how things can be improved. So as we kind of get this project for Clearstone Pharmacy specifically off the ground, we would love to hear how it's going for you. Specifically, Katie, in this instance, as you're working through this in your residency project, let us know how it's coming together, how you're maybe matching up this disparate workflow, and we want to be able to support that to continue to streamline that. Because again, our primary goal is making your lives easier when it comes to this clinical workflow. So definitely appreciate the feedback and just understanding how you're implementing it in your pharmacies and how it's working so that we can continue to improve it on our end as well. So that's great. Okay. So then to circle back here, just in closing, really appreciate you guys hanging on the line with us just a little bit extra time here. To get started, you can complete that training. That's at onerxproject.org/Clearstone as well. It is supported by CE Impact. So you'll manage that and take that course on CE Impact's website. Once you complete the course, you can forward that completion email to support@docstation.co, and then we will enroll your pharmacy into that program, and you'll start seeing tasks after that. I do want to just take a quick moment to mention this note here that it will take some time before you start to see your first safe opioid use task, again, because it's going to be based on your dispensing records. So if you don't have a brand new patient with a brand new opioid to begin with, as soon as you start to see that, you won't see that task for a little bit. But as always, we do have very detailed program help center articles for kind of all of these aspects. So please be sure to check those out. And if you need any additional support when it comes to training, check in with us in the little blue chat bubble in the bottom right corner of the platform. All right, everybody, really appreciate your time today. Thank you again. Special thank you to Elizabeth and Jamie for being here with us. Again, the OneRx team is very accessible should you have questions. So reach out to DocStation, reach out to them as well, and we'll provide any support that you need. Thanks so much, everybody. Have a great rest of your day.
Thanks, everyone.